All right, so here we go. This is like a very crude video. Neurological packages, and we do cranial nerves. So I assume I have permission to do all this exam, and we'll just get to it. So let's start with cranial nerve number 5. So number 5, let's do dermatomes first. So go ahead and roll up your sleeves. I'll just pretend he's in a gown. And so you're going to test light touch. So you can do a crude examination by going like this. Does that feel the same on each side?
Yes.
Okay. We can also test pain. Yeah, I guess I could do it officially. Might as well use some of these things. So light touch is supposed to be done with a cotton ball or some type of cotton. Yeah. Feels the same?
Yeah.
And he would be more exposed. And then you can either break this off so it's a little sharper. Does that feel sharp or dull?
Sharp.
Okay, there's 5. Okay. What's the reflex for 5? Biceps. So this is the one you have to press down on the tendon like this. Okay. So not getting it there, but relax for me. Oh, got a little bit there. Okay, and if you can't get it, what you're supposed to do? Supposed to do some recruitment. So can you just kind of squeeze your legs together? Let's try it again. Squeeze it apart. Okay. And this is what you find sometimes. So they're bilaterally equal. We can't get them, but that's the way it is. 5, the muscle test. Any shoulder problems? Shoulders are good?
Yeah, shoulder.
Okay. So we're going to just test the deltoid power. You just hold your arm right in this position for me. I'm going to drop it. Hold it. Hold against me. Remember, we use ramp up power. Ramp up slowly. Then release. It's good. Go to the side. Ramp up slowly. Great. That's 5. You're all done. Neurological package is done. How about number 6? So number 6, we're going to test dermatomes first. So that's the outside, the forearm and hand. I feel about the same?
Yes.
So that's light touch. Then we can use the broken end of this. Should feel sharp.
Yes.
Feels good. Great. What's the reflex for 6? Brachioradialis. Great. So this one we use the fat end of the hammer. Tap right over the radius. Try different angles. If we couldn't get his biceps, we probably won't get anything. But the key is as long as it's bilaterally the same. Just relax for me. Okay, squeeze your legs together. Let's do recruitment. Relax here for me. Okay. If you can't get it, you can't get it. Okay. So that's just the way he is. That's done. 7. So let's do 7. So go ahead. You all remember 7, right? Probably one thing you do remember. Just right here, the finger. Lift this up. Weightlifting calluses.
Yeah.
You feel the same?
Yeah, they feel the same.
Okay, and now we'll do sharp. Great. Reflex for 7. Triceps. Triceps. Just relax for me. Use the pointy end. And I'm not expecting to find anything because I haven't found anything yet.
Right.
Go ahead and recruit. Squeeze your legs together.
There. That was small one.
Okay, good. That's 7. Did we do the muscle test for 6? I don't think we did the muscle test. Go ahead and cock your wrist back. So it's wrist extension for 6. Great. Great. Okay. And now 7 is wrist flexion. Remember the yeah. 7 flexion, or you can do finger extension. So wrist flexion is usually tested. Hold strong for me and do that ramp up pressure. Ramp off. Great. Hold. Ramp up. Great. Great power. That's 7. So 8. Okay, let's go back. Reflex for 8. No reflex. So go right to sensation testing. So that's the medial side of the hand. Use the cotton for light touch.
About the same.
About the same. We can now do sharp.
About the same.
Great. No reflex muscle test for 8. Remember, it looks like an 8.
Yeah.
I just pulled it.
Yeah, you just do it. Great. 8 is great. Okay, T1. So usually not too much things go wrong with T1. That's right here. Not the same. Sharpness. It's that, remember the medial brachiocutaneous nerve? About the same. Reflex? No reflex. Great. Let's go down here, L4. So L4 will pretend you're in a gown. And 4 to the floor. So that would be the inside here we would test. He would be in the gown, so we would go skin to skin. That's 4. Testing like this and this. About the same. Reflex for 4. Patellar. That little one here. The same there. Great. Okay, there's several muscle tests we can do for this. 4 is like the crude one, you just have them walk on their heels. I don't know if this is going to pick up on the camera. Can you like extend your leg up? See that? So you can just do dorsiflexion. So you pull your toes up like that, and you push down like this. So we're testing dorsiflexion. It's tibialis anterior, so you could even turn it in a little bit. So kind of turn it in that way a little bit. Great. Let's do this one now too. Turn it in a little bit and hold. Great. Okay, that's 4. Number 5 is the outside of the leg. So you could do out here. Is that showing? Can you see in the back of the movie thing? Am I getting his legs?
Mm-hmm.
Great. So you can do the outside of the leg. And if I could bend my old bones down, which I can't, you can do that. You can kind of go that. You can do the top of his foot. That's for 5.
Got nothing.
Got nothing. Of course, shoes and socks would be off. Reflex for 5. There's an adductor reflex, but really we don't do that. Felt says you don't do anything for 5. Muscle test for 5. What is that? That's a good one. Extensor hallucis longus. Once you can pop off your shoes, let's do that for real. This one's actually clinically important. I do this one all the time in my practice.
Both are.
Yeah, let's just do it for real. You go ahead and extend your leg straight and pull your toe to your nose. Hold strong. Great. Let's do this one.
And then muscle testing for 5?
That's 5. Yep, extensor hallucis longus. Great. Reflex, no reflex. You can do the adductor reflex, but I don't really believe in it. And the board books say don't believe it. S1. Okay, bring your feet up again for me. So S1 is the outside of the foot. These things you'll use all the time when you get out of practice. These things you gotta know. Feels the same,
Yeah.
sharpness. There's proprioceptive fibers to these too, but you can't really test that. The reflex is, I can't bend down that far, but I can get them to relax like this and go, it's actually working a little bit. So that's the Achilles for S1. And you, when you're young, then you can just squat down and do this, but you want to dorsiflex the foot. You can see it moving. And let's see, muscle test. I usually have them do single leg calf raises like this. Like if you really want to do it. It's a powerful muscle. Great. And you have them do 10 on each side. That's what I do in practice. Go ahead and have a seat again. For you guys, you're supposed to go, you can just do that manually. So go ahead and just plantar flex for me and hold. Okay, let's do that one. And you're supposed to put a little eversion in there too, the proneus ones. So I can pull it like that too. That looks great. Pull this up, that way. And now push. Great, he's got really good power. That's it, S1. Is there an S2? No. There's no S2. All right, so that's it for that part. Let's do cranial nerve testing. So go through that. We have my sense today. Cranial nerve 1, there's only one test. So I will be testing your sense of smell today. So first thing, make sure that their sniffer is working. Can you plug one of your nostrils for me? And just take a little breath in to make sure it works. It's working. And now the other one. Kind of working. Okay.
No, this one's down. Yeah.
Okay. So now go ahead and close your eyes and plug your left nostril or your right nostril. So, okay. And breathe in. Don't like crazy inhale, but just very gently breathe in and tell me what you smell. If you smell anything, you may be faking.
Or coffee.
It's cinnamon, but that's close enough. He's cheating.
Not cheating. I'm not cheating. My eyes are closed.
Okay. Okay, now close the other one, then we'll test the other one. And you can do 2. I mean, for time, 1 is fine. Again, breathe in. Tell me if you smell anything.
Okay, now that's me.
Yeah, there you go.
Okay.
Great. All right, so sniffer is working. And normally they should be able to smell. If they can't smell, that's called anosmia. So no anosmia, and refer them to a eye, ear, nose, and throat specialist for this. Cranial nerve 2, what's that one?
Optic.
That's the optic nerve. So we have visual acuity, and then we have the visual fields that we have to test. There's 2 things for cranial nerve 2. For acuity, we use the Snellen eye chart. There's not one here, but we have a pocket one. And it's supposed to be held 14, this side is 14 inches. So I'll just kind of do it like that. So go ahead and why don't you read line 5 for me, this one right here.
DHJBS.
Oh, and one important thing, can you cover your
Same line?
Yeah, let's read this line right here.
DHJBS.
Is that really easy?
Yeah.
Can you even read the smallest one?
LTFPH.
Okay, so that's the smallest one. But you have them keep reading lines. Let's say he missed 1. They can miss no more than 50%, so you're supposed to have him keep challenging him for lower and smaller lines until he misses 50% or more. And then you read what it says there. Let's say he could only do this line and it says 20/25 vision. So then you have to tell me this. For his left eye, he has 20/25 vision. And then I'll say, what does that mean? And that means that he can see at 20 feet what a normal person can see at 25 feet. Okay, that's all you have to say. But you have to be able to read the line. When we're in the classroom, you definitely want to use the bigger chart because it has numbers and it's more, this just goes to normal vision and that's it. It doesn't test any further than that. Okay, let's switch other eyes. And then just, let's try this one. This one's a little more challenging, isn't it? How about read line 8? Just read those first 2 numbers better.
6, 3, 9, 2, 5.
How about the next one?
4, 2, 8, 3, 6, 5.
Yeah, I can really see that. This one?
3, 7, 4, 2, 5, 8.
All right, so he's way past 20/20 vision. Damn. So he's got 20/20 vision on this side. But if he had, let's say he had 20/50 vision, so that would mean he can see at 20 feet what a normal person can see at 50 feet, so he can't see very good. That's all you have to do for that. So that's visual acuity. And then we have, thank you, so we have visual field testing. So this is the one where there's an imaginary like plane right here. And let's see, can you kind of scoot this way right there? This is the finger wiggle test that you can do. Okay, so you go ahead and block that eye off. And we're testing really his peripheral vision. And you look right at my nose. Can you see my face okay? No holes in my face?
No.
Okay. And we're testing just there's this imaginary plane right here. We're going to test all these 4 quadrants of vision. So you tell me when you can see my fingers already. I can see them now. Tell me when they start wiggling. That's one way you can do it. Or you can go like this. I don't even see it yet. Nice. Okay. Officially, you're supposed to bring it from out of your plane of view. It's wiggling. I can't see it. Now I can see it. I never have my peripheral vision checked. So test that quadrant. Now this one.
I see it.
Okay. Now this one.
No, I see it.
Okay. And now this one.
I see it.
So remember, we have superior nasal. This would be the nasal side. This would be the temporal. Superior nasal, superior temporal. This would be inferior nasal, and this one will be inferior temporal. So we make sure he can see that. Okay, switch eyes, and then we just repeat. And then remember, the examiner has to close the same eye. So I'm closing this eye.
I see it. Now I see it. Now I see it.
That's where I see it.
Now I see it.
I see this one. Okay, great. So he has no problems with peripheral vision. All right, that's cranial nerve 2 is done. Cranial nerve number 3 is a big one. So cranial nerve 3, we have 2 nerves that we have to test. We have parasympathetic test, and then there's a somatic test. Somatic test moves the muscles through the cardinal fields of gaze. So it's the cardinal fields of gaze test that we'll do first. And this is the one where both conjugate movement, both eyes have to move at the same time, and you do an H pattern. Okay, so now you look, just keep your head perfectly still, but I want your eyes to move only and not your head.
Okay.
And all you do is you outline an H, and we'll start right over here, and I'm just watching his eyes go up here. And remember to hold it, and then go down. Okay, can you test that one more time? And what are we looking for? And making sure that the eyes are locked on target together. And do it a couple times and hold it at the end, because if this is going to happen, it's going to happen here on the end. I think he does have a 1 beat of strabismus, which is pretty much normal. Okay, and now let's go up here. Great, so that's testing the cardinal fields of gaze, and they look good. The eyes were locked together. What's that?
Ocular motor.
That is ocular motor. That is the somatic efferent division. Okay, you're also testing 5 and 6, cranial nerve 5 and 6 with that test as well. Okay, so that's the easy one. But now we have the parasympathetic efferent fibers. So those are a little more challenging. We've got to get the pen light out for that one. It's not really challenging. Understanding it is more challenging. Okay, so we're going to do the reaction test. There's the light reaction test, and there's the near reaction test. Right? Let's do the light reaction test first, and we're going to see if his pupils constrict. The light reaction test has 2 parts. It has a direct light reflex, and a consensual reflex. So it's kind of a two-part test. So all you need to do, and we don't even need to do that. All right? Oh, you have brown eyes, so it's going to be challenging. So let's try. So for the first part of this test, I'm going to test that would be his left eye, and I'm just going to watch his pupil and see if it constricts. And it constricts real nice. So that's part one. That's for the direct light reflex test. And now I'm going to focus my attention to the opposite pupil. This is the consensual light reflex test. Just look up a little bit for me. And it's constricting real nicely. Okay? Great. So he's got a normal direct light reflex and a consensual light reflex. And that's all there is to that test. I guess we're not going to ask many questions. I'll do that in class since I went over that. But I could say if there's a lesion in oculomotor on the oculomotor nerve efferent parasympathetic fibers on the right, how would that affect this? And there would be no consensual reflex. But we'll save that stuff for lecture. Okay? The other one is the accommodate, or should call it that. It's the near reaction, it's called. These are both reaction tests. And this is a three-part one as well. So there's a couple ways you can do this. So first of all, you're going to test motor to see if his eyes can converge on the target. So just watch this, and as it gets closer and closer, really focus on it and see his eyes are going kind of cross-eyed. So medial rectuses are working just fine. So that's the first part for convergence, that's called. And now I'm going to focus, just lift your head up a little bit. I'm going to watch his pupils, because as he watches this come in, his pupils should constrict. And they are constricting. I'm going to do it one more time. Make sure the other one is constricting. Great. You can do it like that, or you can just put it like this and say, look at the back of the room, don't focus on this. And now focus right on there. Right on this pen. And the pupils constrict as he does this. So that's another way to do that. Okay, so that's just, you can call that the meiosis response, or the pupil constriction response. And the last one depends on his ability to read. So it's nice to have some kind of card. I think I have, but there's like little writing here. So what I want you to do is focus on the card and bring it about 10 centimeters and just, can you read that sentence there for me?
We have a turkey on Thanksgiving Day.
Nice. So I know his accommodation works. So the way that works is when this comes close, parasympathetic fibers, they innervate the ciliary muscle, and that relaxes the lens, so the lens fattens up so it can read really close. So we just tested cranial nerve 3. Okay. Cranial nerve 4 we really already did, and cranial nerve 6 is part of cranial nerve 3 testing, the somatic efferent, so we really don't need to do that. We could, though, if we test cranial nerve 4, what's the name of that one? Trochlear. What's the muscle? Superior oblique. So if we test this eye for superior oblique, it moves the eye out and down. So just look straight ahead and follow my finger. Out and down. So we just tested that. Okay. Cranial nerve 6, what's that one? Abducens. What does that one do? That's lateral rectus. It just pure out. So keep your head straight ahead and just follow this one. And we're just seeing if the eyes turn out. So both lateral rectus muscles are working fine. If you draw that one, I'll probably combine them. I'll try to make them like the same level. Cranial nerve 5, the trigeminal nerve. So we go back to our little stick again. That's mainly a sensory nerve. Remember, there's V1, V2, V3. V1's the champion, stands on the podium. V2, V3 is down a little bit lower. So that's just, this is ophthalmic nerve. So you tell me if you can feel that. Same as that. Okay. And this are the cheeks. Great. Light touch. There's the mandibular division. Great. And then be careful not to poke him in the eye when you do this. Should feel kind of sharp.
Yes.
Nice. We should have him close his eyes too. just in case you poke him in the eye. Won't hurt his back. Feeling sharp everywhere?
Yes.
Great, so we got that. Is that it, or do we have one more thing? Is there a motor division?
Yeah.
Yes, the
Mastication.
muscles of mastication, right, mandibular nerve. So go ahead and bite down hard for me, and you just palpate his masseter. Now relax, bite again. And you can feel a pop right on. Relax, bite, and temporalis will check. Great. We can test lateral pterygoids by having him open his mouth. So go ahead and open your mouth really slowly, and make sure it's aligned. If it wasn't aligned, let's say it was off to this side, so that would mean it points toward the lesion. That means this lateral pterygoid is more powerful and it pushes the jaw away from the weak side. So you should remember which side it points to the lesion. Let's see what else we can do. We can do jaw jerk on this as well. This is all cranial nerve 5, afferent limbs. Is cranial nerve 5, mandibular, and then it goes back to the temporal or the masseter muscle. So you just put your thumb like this, just relax your jaw open a little bit, open, just relax, like go to sleep, open a little more, relax. That's how you do. That's kind of par for the course for him.
And what are you looking for? That one.
That's the jaw jerk.
But like, what are you looking for?
For a reflex,
Okay.
but it's the same. If he doesn't have other great reflexes,
What would be the,
The
what
response?
would it do?
it would jerk. It would jerk. Just his,
Oh,
yeah. Or you can see the masseters contract
oh.
as well. Let's see. I think that's it for 5. Right? We did sensory muscle, jaw jerk. 6 is done. 7, so that's muscles of facial expression. So can you smile for me with your teeth not showing? Now smile with your teeth showing. And like raise your eyebrows, like surprised look, sad look, very sad look. Okay, puff out your cheeks like a bullfrog. Great. If you have paralysis of these muscles, it'll poke out too much. Like it's resisting you from going to like Louis Armstrong, the trumpet player, had masseter paralysis, or what's the name of that muscle right here? I can't remember. He had paralysis of those cheek muscles though, and he looked like a bullfrog when he played.
Wow. That's actually interesting.
Yeah. Let's see what else. And then close your eyes really hard. Okay. My hands are clean. You can wear gloves when you do this as well, but you can also try to hold these open. Make sure. Subicularis oculi is a very important muscle. Great, we did that. Cranial nerves 7, what else?
That it?
I think there's no motor. There's parasympathetic like crazy, but you can't really test it. Like, do you have any problems with taste? Does the anterior 2/3 of your tongue supplies the taste buds? Parasympathetic afferents, which is kind of weird. Any problems with dry eye? It's parasympathetic efferents to your lacrimal gland. Let's see. Saliva we have to be careful with because remember the parotid gland is supplied by cranial nerve 9, parasympathetic efferents. And the submandibulars and the sublinguals are supplied by parasympathetic efferents, cranial nerve 7. So you can still ask him any dry mouth problems, everything's okay. Okay, great. I don't think there is anything more that I can remember on that one. Now we're going to cranial nerve number 8, Weber and Renee test. Okay, your tuning fork should be 512 tuning fork. And we've already explained everything, so I'm just going to test your hearing to make sure you can hear. Is that okay? Yes. So activate this thing. So the Weber test. Tell me, can you hear that in one ear better or this side? This side. Okay, that's the Weber test. The key for the Weber test, I will definitely ask you, if you can hear it more in this ear, that means sound has lateralized to the left. And what does that tell you? That means that either this ear is plugged up with wax, he has a conduction blockage, or he has a nerve problem in the other side. And we don't really know which until we do the next test. Question.
What if you can't hear it from either?
From either,
Yeah.
then it's the same. He's either deaf, which you would already know, or he's got double conduction blockages. But you wouldn't even be testing him at that point. Okay. Now the Rhine test or the Renee test. So you're going to just tell me the same. I'm going to put this behind your ear, and you tell me when you can't feel it or hear it anymore. You have to count 3, 4, 6, 7.
Now it's gone.
Tell me when you can't hear it again.
Now it's gone.
Now it's gone?
Yeah.
That should be, so that's not right. It should be just as long so it might have some blockage in that ear, that means. Because you should hear it the same amount. Let's try that again, because I'm kind of counting them. Okay, that was longer. So the air conduction should be longer. It should be twice as long or longer than the bone conduction. Okay, let's try the other side. Notice how I'm putting these sticking straight up like that.
All right.
A couple centimeters from the ear. Don't stab them in the ear with it.
All right.
That's definitely at least as long, not long. Okay, so that was the vestibulocochlear nerve. That was the cochlear portion. Vestibular is a balance test. So there's a Dick Hallpike's maneuver you're supposed to do for that. I think they have you doing Romberg's test, which that's more of a cerebellum proprioceptive problem, so it's really not the correct test for that. But we'll show you real quick. Go ahead and stand up for Romberg's test. And put your feet right together. And look straight ahead and close your eyes. I should be standing behind him. And we'll note the amount he wobbles. Oh, go ahead. You should open them first. I jumped right to the test. So open them first. Let him get accustomed. Just like focus on the back wall. Note the amount he wobbles. And now close your eyes and get ready to catch him. See the wobble increase? That's still not a positive. I've seen these positive where they literally, you have to catch them. So it's normal for them to wobble a little bit more. What we did is with his eyes open, he's using the cerebellum for proprioception. When he closes the eyes, the cerebellum is out of action, so it relies on all the proprioceptors in his legs and arms. And people with cervical problems, if you know what stenosis is, you know what the vertebral canal is, if that gets full of bone, overgrowth of bone, and it pinches the spinal cord, it knocks out the proprioceptive tracts, and they get really, really wobbly. So that's a really good test for stenosis. Okay? Cranial nerve 9 and 10. Go ahead and sit back down. Number 9 is not fun.
Oh,
Yeah. I should have my gloves.
Okay.
But my hands are so this part is clean. So cranial nerve 9 is sensory to inside the mouth. There's the oral cavity, and if you go back, that's the oropharynx. So if you touch the back of the tongue or the sides of the oropharynx, that will induce a protective response to contract the muscles. In case he's like accidentally swallowing something, it's a protective response. That's called the gag reflex. And really for cranial nerve number 9, that is all we have. So go ahead and open your mouth up, way wide. And there's also these little pillars. Did we talk about the palatoglossal palatopharyngeal arches yet? We will be covering those. The tonsil sits between those. You can touch one side of that, and sometimes that will elicit the gag reflex as well. So let's see how he does. Open up. I'm just going to touch on the side of his mouth. Stick your tongue out a little bit for me. Okay, it's working. Now let's see the other side. Oh, that side's more powerful. That side's way more powerful. That was the gag reflex. So we know
Sorry.
that side. That's okay. Let's get rid of that. Let me get that hand. Let me get that.
You're a quitter. Fine, I'll resist it next time.
Yeah, I'll probably leave that part off the test. Because that's not fun. Go ahead, open up. Oh, and let's test cranial nerve 10 now. Cranial nerve 10 is motor. So it goes to the vocal cords. So to test cranial nerve 10, can you say Mary had a little lamb?
Mary had a little lamb.
Can you swallow for me? We watch the laryngeal prominence to make sure it raises. All the swallowing muscles pull all that stuff up. Swallow one more time. Okay, great. And
There was no slide. I was ready.
okay, and now go ahead and open up. Let me just take a peek in there and see what's going on. Stick your tongue out. You kind of flatten your tongue for me so we don't have to. Okay, now say ah. Wait, one more time. So both the left and the right soft palates are raising up, and the uvula is being pulled straight up. You know that little thing that hangs down? That's the uvula. And don't look at the uvula, look at the soft palate that it connects to, because some uvulas are pointed left and right normally. They're not perfectly straight, so it's better to watch the soft palate. But that reaction saying ah tests cranial nerve 10 mainly. To test cranial nerve 9, we have to do the gag reflex. And, a lot of the books, like the real neurology books, say that really is not. I mean, we can figure things out easier than having to do that to people. So that is, let's see, what are we missing? That's 10. We have 11 spinal accessory. That goes to the traps and the SCM. What else goes to the traps that's powerful? Levator scapula. So it's really best not to test the traps. But the SCM muscle is pretty much pure cranial nerve 11. So if I put my hand in his cheek and you turn your head toward that wall and I resist, we're testing the power of this SCM right there. And it feels nice and strong. So we're going to do the other side. Go ahead and turn toward the door. Nice and strong. Okay. Bilaterally, we could have him flex his head. Go ahead and flex your head down. Bend your head down. Nice and strong, but there's other muscles mixed in. So really the big one is just turning the head. But you got to remember, turn the head that way, it's this muscle that's engaging. And then you look for weakness. Last but not least, and that's it for spinal accessory, there's no sensation. Last but not least, we have the oculo or cranial nerve 12, hypoglossal nerve. And that's just your tongue, that's genioglossus muscle. And that's right, that's really all you do. You go ahead and stick out your tongue for me. And just kind of let it go straight down. And when it comes out, you want to make sure it comes out straight and not crooked. If it comes out crooked, again, it's going to point toward the lesion, toward the weak side. So make it go crooked for us. So that would mean the weakness is on this side of the tongue. Make sure you know what side the lesion is. One more part of the test. So now put your tongue in cheek. Push your tongue right in there and hold it strong for me. And the other side?
We'll do it on camera.
Great.
No, I'll be there forever.
I think that is it.
Good job, Ray.
Thank you very much.